through the camera. Thank you very much. Today we're talking about parents who suffer from COPD and what you as a family member can expect. Now, before I get started, I'd like you to meet my mother. My mother suffered from COPD. She was diagnosed in her early 60s, and this was a result of her smoking since she was 14 years of age. Now, you're probably wondering, what exactly is COPD? COPD is chronic obstructive pulmonary disease. According to Johns Hopkins University and PubMed, there are two forms of COPD, emphysema and chronic bronchitis. Sadly, most patients suffer and exhibit both of the two different types of COPD. Now, the symptoms can vary, but in most cases, it's shortness of breath, coughing, wheezing, and in many cases, gasping for air. They're having a difficult time regaining their breath. Now, the treatments can vary depending on the severity of the disease. In the early stages, it may only be something as simple as some steroids, some inhaler, and a bronchial dilator. The other thing is that you have to follow the doctor's directions. You need to stop smoking, and you need to have a smoke-free environment. Otherwise, you will cause the disease to progress rapidly. Sadly, for my case, my mother did not quit smoking until 4 months before she passed away. So she didn't have that opportunity to live 11, 10 years with COPD because she forced it to progress itself by putting the smoke in her lungs. The other thing about COPD is that it is fatal. Again, according to Johns Hopkins University, this is the 4th leading cause of death in the United States. Now, one of the things that I have to say, what you can expect with COPD is a patient who is going to suffer. In the beginning, not so much. As with my mother, when she was initially diagnosed, she was fine. She was able to do the things that she normally did. She just had a nagging cough and some wheezing. So she would take, just an inhaler and the bronchodilator, and she did okay. But over time, as the disease began to progress, she required more medication. She had to have a machine brought in the house to provide her with oxygen, and she also had to take breathing treatments, which had this liquid medication that you put in this little cylinder, and I think it was, I forgot what it was called, but it had a steroid in it, and she would have to breathe this in, and it would open up her lungs even more. Then towards the final stages of the disease, my mother was miserable. She was unable to walk. Sometimes talking was difficult. Dressing was difficult. Going to the store, she required constant care. She couldn't do it on her own. A lot of times people would do it for her. Even getting dressed was impossible. Now, as the primary caretaker, you have a lot to deal with. In the beginning, I was fine. She was able to take care of herself. But as the disease progressed, it required me to do more for her. I had to go up there and keep track of her medications. And I would also go with her to the doctors occasionally because she was concerned that she would not remember things. Then during the final stages of her disease, because she was so disabled, she required a lot of care. She was unable to take care of her home. She was unable to cook. She was unable to get dressed. She was unable to drive. She was unable to walk. So she required somebody to be with her almost 24 hours a day. Now, another thing that comes into play is mental health. When someone who has any kind of illness, but especially COPD, you're going to deal with depression. As the disease progresses and they begin to feel worse and they have a lot of their independence taken away from them, they become more and more depressed. At the end stage for my mother, she was so depressed that she was irritable all the time. She snapped at everybody. She screamed at me constantly, of course, because I was the one that was around her the most. And most of all, she would say on a regular basis, "I'm such a burden, it would probably be better for everybody if I just died." Now, one of the things that I have to say is that I was not prepared for my mother. I didn't do the research. I didn't ask the right questions. I didn't ask for help when I should have, and I wasn't prepared for her mental instability. So the 3 things that I can tell you absolutely must do is you need to do your homework. You need to get out there as soon as you find out. You need to go on the internet, go to the library, talk to the doctor, get as much information as you can so you can be prepared. And if you're not satisfied with the answers that the doctors are giving you, ask some more. Don't be satisfied with just whatever he throws out at you, because you need to know. The other thing that you need to do is you need to be prepared to deal with the mental issues that come into play. When you start to see the depression set in, address it. Have your parents see someone or talk to their doctor about mental health care to get them through the depression. In addition, you need to be able to handle the depression that's coming at you, because you're going to become depressed as well. You need to talk to other people, because you're gonna become very overwhelmed with this depression. And the third thing I have to say is you need to get help. You need to have somebody help you take care of this person, because you're going to need a break. It's a lot of work. All right, if there's any questions by any chance? No? I'll be more than happy to answer any questions that you may have. All right, if you could do me a favor, come over here and walk in front of the camera for me. And wave. Thank you very much. I would like to say thank you very much for taking the time to listen to me.